Welcome to Lesson 8.2, Complications of Diabetes. In this lesson, we will review several different macrovascular and microvascular complications that can result from chronically elevated blood glucose. We will also look further at prediabetes, followed by some time and discussion to investigate specific preventative strategies related to diet and lifestyle. Diabetes leads to increased risk of vascular complications, which are worsened by poor control of blood glucose or blood pressure. They can be classified as macrovascular, meaning they affect the large blood vessels in the body, microvascular, meaning they affect small vessels, or both. These complications can increase both morbidity and mortality of individuals with diabetes. As I mentioned, macrovascular complications primarily affect large vessels of the circulatory system. Examples are the increased risk of cardiovascular disease and stroke. Diabetes also increases the risk of peripheral vascular disease, or PVD. This is a circulatory condition that affects the peripheral vessels, or those far away from the heart, like the arms or legs. In each of these cases, vessels become narrowed, which can lead to blood clots. The picture on the bottom left shows a person with PVD. You can see in the diagram on the right that plaque builds up in the artery supplying blood to the leg. This causes decreased blood flow, which leads to various symptoms and complications. For example, a person with PVD may experience pain, numbness, or burning in their legs and feet. It can cause skin changes, as you can see in the photograph. PVD can also lead to ulcerations that will not heal, gangrene, and amputations. Microvascular complications, as the name implies, affect small vessels of the circulatory system. This leads to common conditions, including neuropathy, which refers to nerve damage, nephropathy, which is damage to the kidneys, and retinopathy, which involves damage to the eyes. Neuropathy is considered the most common long-term complication of diabetes, with estimates of nearly 60% of individuals experiencing some form of nerve damage. It is a progressive disease that can lead to pain that often feels like burning or tingling. It can also cause weakness and loss of sensation. It occurs frequently in the hands and feet, but can also affect other areas of the body. Ultimately, it can lead to trouble walking and falls. It can also lead to undetected minor injuries, which then become infected and can ultimately lead to amputations, just like we saw with PVD. Follow this hyperlink to watch a short video illustrating how elevated blood glucose can affect the nervous system. Diabetic nephropathy refers to damage of the kidneys. As illustrated by this picture, the kidney is made up of small units called nephrons that filter blood and help remove waste from the body. In someone with prolonged elevations in blood glucose, the nephrons can become scarred and thickened, leading to waste building up in the body. Nephropathy is the leading cause of chronic kidney disease, or CKD, which refers to a gradual loss of kidney function. CKD is divided into 5 stages, with stage 5 being end-stage renal disease, or ESRD. At this stage, patients generally require dialysis or a kidney transplant to stay alive. The best ways to prevent nephropathy or slow its progression are to control blood glucose and blood pressure. A recent cohort study looked at risk factors for CKD in 6,916 people with diabetes. These risk factors included BMI, physical activity, social network score, alcohol intake, tobacco use, and dietary patterns. The specific dietary factors included things like intake of vegetables, fruits, nuts, whole grains, red and processed meats, and fried foods. Researchers found that decreased risk of CKD and/or death in those who had a healthy weight, were physically active, had a larger social network, consumed moderate amounts of alcohol, avoided tobacco, and had a healthier diet. The strongest dietary factor was high vegetable intake, especially leafy greens. Researchers also found that positive habits had a cumulative effect. Subjects with a higher number of positive factors had a lower risk of CKD and mortality. Since this was an observational study, we can't assume a causal relationship exists, but it does give some credence to the idea that good lifestyle habits could reduce risk of poor outcomes for some people, and that individual lifestyle factors can each have a positive effect. In other words, it may not take a huge diet or lifestyle overhaul in order to experience appreciable benefits. Watch this brief video to learn more about the kidneys and diabetic nephropathy. Elevated blood glucose can also damage the retina, which is the light-sensitive lining in the back of the eye. This is known as retinopathy. In the beginning stages, there are often no symptoms, which illustrates the importance of regular eye exams. In some cases, the identification of retinopathy can lead to a diagnosis of diabetes for individuals who were unaware they had the condition. Once diabetes is present, regular exams can catch retinopathy from the beginning and monitor progression. Once symptoms start, they usually involve blurred vision, dark spots, floaters, or trouble seeing well at night. When left untreated, it can lead to permanent visual impairment and even blindness. Diabetic retinopathy is a common cause of visual impairment and blindness. According to recent CDC estimates, 28.5% of adults with diabetes who are 40 and older have diabetic retinopathy. The longer a person has diabetes, the more likely they are to develop retinopathy, but the best way to minimize damage is to control blood glucose. Watch this very brief video for an illustration of diabetic retinopathy. Here is a visual representation of the conditions we just discussed. The boxes on the left represent the microvascular complications, which affect capillaries in the eyes, kidneys, and extremities. And the box on the left describes the macrovascular risks, like the 2 to 4-fold risk increase for heart disease and stroke. We know diabetes is associated with microvascular complications, and we also know it is associated with macrovascular complications like cardiovascular disease. A group of researchers recently aimed to find out if there is a relationship between the cumulative burden of these microvascular complications and the risk of cardiovascular disease. In other words, do more microvascular conditions further increase cardiovascular risk? This is the study in your reading list by Brownrigg and colleagues. It was a population-based cohort study of about 49,000 people with diabetes. The researchers looked at hazard ratios and event rates for the primary outcome, which referred to the first major cardiac event, either a non-fatal heart attack, a non-fatal stroke, or cardiovascular death. They analyzed data using the 3 microvascular diseases we've just discussed: retinopathy, nephropathy, and neuropathy. And they also looked at traditional risk factors for heart disease, like hemoglobin A1C, blood pressure, LDL cholesterol, weight status, and smoking. One of the goals of the study was to better identify individuals' risk for cardiovascular disease. Here is one of the figures from that article. Section A represents the primary outcome I mentioned on the last slide, which includes cardiovascular mortality and non-fatal heart attack or stroke. In Section B, they also looked at admission to the hospital for heart failure, and Section C shows just cardiovascular mortality. You can see that in each section, the first 3 lines represent 1, then 2, then 3 microvascular disease states. And in each section, the adjusted hazard ratio increases as the number of microvascular disease states increase. And if you look at Section A, it appears that just one microvascular disease is more strongly associated with the primary outcome than any of the traditional risk factors like blood pressure or cholesterol. When looking at event rates, you can see a consistent linear trend, with the highest incidence shown as the purple bar on the far right, which represents the rate for those with 3 microvascular disease states who also have poor control over conventional risk factors like hemoglobin A1C, blood pressure, and cholesterol. Again, this was an observational study in a specific population, so we can't determine causal relationships or generalize to all population groups. But these results suggest that consideration of microvascular disease presence could better estimate cardiovascular risk for individuals with diabetes and could therefore impact treatment approaches. As I explained in the last lesson, prediabetes involves impaired fasting glucose or impaired glucose tolerance and is often a precursor to the development of type 2 diabetes. What is also important to note is that research is finding that risks for cardiovascular disease are already present during this stage. And also, each of those 3 microvascular complications we just reviewed, retinopathy, nephropathy, and neuropathy, have been seen in people with prediabetes. The Brannick article in your reading list describes prediabetes as a toxic environment. It's not totally clear at this point why some people develop these complications while they have subdiabetic levels of blood glucose, while others develop them only after years of inadequately controlled hyperglycemia. Several proposed mechanisms are explained in the article, including genetic predisposition, activation of toxic pathways that can lead to tissue damage, or a multiplier effect, where a combination of factors in certain individuals leads to increased susceptibility. Regardless which mechanism or mechanisms are responsible, evidence from various studies points toward the importance of a comprehensive approach towards prevention that includes various lifestyle interventions. We will discuss important areas for prevention in the next 2 modules.